Hi everyone, this is Deepa with Allen Pharmacy and Wellness. We're located at 945 West Stacy Road in Allen, Texas. And I apologize, I haven't made any videos in the last few weeks. It's just been a lot going on. But that said, there's a lot going on even with our SARS-2 COVID-19 issues. So I felt that this was imperative that I take some time today to just kind of discuss what's going on. And I've had a lot of questions about vaccines and what do I think, and so I thought it would be a good time to just take a few minutes and address that today. So we are in this talk, I'm not going to be discussing the controversy about whether we should get the vaccine or not. That's going to be a whole new can of worms that we will probably open for a different talk. But what we will talk about is what it is that it means. What is this whole topic about? What are they talking about? What is the vaccine going to do? And that sort of thing. So what does a vaccine really do, right? Like it kind of when we're getting a vaccine for something, we are introducing a little bit of the virus into our body so that our immune system can trigger some sort of a response, and then our immune system remembers that response. And so if we actually were to get the disease in real, then we would have some kind of immunity built up for it. Now, does that mean that that's going to be the same thing that happens for the COVID-19 vaccine? We don't know, right? Because everything is so new with this virus. There's no real way to know how this vaccine is going to be working. I know that we've passed phase 1 and phase 2 testings, which means that they have certain criteria for the vaccine and that they have proved some kind of safety and efficacy. And now we're trying to figure out just what dose of that vaccine may be working or not working. So we're in that phase 3 right now. But I know that with the amount of stress that's around it, right? The economy is being affected, the financial recourses, people that are severely sick and even dying. So there's a lot of fear, anxiety, and we need answers quickly. So I know that we're probably rushing through a lot of the studies here to try to get some sort of a response and to get some kind of preparedness for the upcoming flu season. So I know that it's probably going to be rushed a little bit, but we're waiting and seeing. We know that the government has already invested billions of dollars to make sure that as soon as the safety and efficacy is shown for the doses that they make, these vaccines are already being made even without the results coming out. And so what does that mean, right? Does that mean that we're not doing the studies? No, like we're still doing the studies, but they have already went into production. So what does that mean is if those studies come back and it shows that, okay, either the vaccine was not safe or that it wasn't effective at all, then what do you do with all these vaccines that have been made, right? So those would, of course, all have to be discarded because clearly they're not safe or effective. And so what we've lost at this point is money, of course, but at least if everything comes back, positive, with fingers crossed that it, yes, it's safe, yes, it's providing some kind of efficacy, but then we're not wasting the next few months in the development, right? So we're trying to think ahead and be proactive about it. So we will keep on top of that and bring you more information on that as we know more. But that's what that really means, that's what we're working towards, because as the flu season starts to roll in, this isn't going to get any better. And in fact, it's only going to be causing a lot more anxiety, a lot more stress, and we don't want to be going back to where we started off with all the closures. So what does it also mean? Like, what are they talking about when they're talking about safety, and what are they talking about when they talk about efficacy? And so when they're talking about safety, well, the first thing is, of course, that it's not going to do any harm, right? Any more harm to a patient than what the COVID-19 actual disease can do. So that's what they're trying to figure out with the safety. And when it comes to efficacy, there's so many different things to look at. We have to figure out what dose is going to be effective. How effective is it going to be? Is it going to be 60% effective, 70% effective? And even if those percentages, what do those percentages mean, right? So at this point, I would even take 60% effective, right? Because if that means that the severity of the disease will be lower, if that means that we can keep people out of hospitals, out of the ICUs, not on ventilators, then that's a big step forward. If we can prevent death, then yeah, we've taken some kind of step towards helping, curb the COVID-19 disease and the pandemic that we have. But and then what else does it mean, right? Does it mean that how long is it going to need? Are we going to need booster shots? But because SARS-2 is an mRNA-based virus, we can pretty safely assume that it's not going to be like a measles type of vaccine where you just get one dose and you're done, or you get, mRNA-based viruses generally will mutate and they will change, but they don't change so significantly that the vaccine wouldn't be effective, right? So because it is an mRNA-based virus, we know that it will mutate, but we don't know how often it does that, and we don't know how long. So we have to figure out like how soon or how long will the vaccine last. And of course, a lot of these answers cannot be figured out until we're in it, right? Like, so a lot of it will have to come through studies and waiting and watching to see how things progress. So we will stay on top of that. And of course, I'm sure everybody is trying to find out as much information as they can about everything. But it may be like, at this point, we take the flu vaccine every year. It doesn't mean it's 100% effective, no. But we still take it, and we still advise people to get it, because it means that, if you were to contract the flu, it will decrease your symptoms. If it can decrease, the severity of the symptoms and also how long you will have the flu, then it's worth it. So it would be a similar trajectory, even for the COVID-19 vaccine. If it can decrease the symptoms, if it can decrease the severity of the symptoms, as we already talked about, and if it can prevent death, then yes, it might be worth spending that kind of time and energy into investing into something like this. So, and another, so we may need some kind of efficacy boost, and that may be okay, but at least it's a step in the right direction. What it doesn't mean is I don't want anyone to have like a false sense of security here. Even if we have a vaccine, I don't think that vaccine is still going to prevent transmission of the disease if you were to have it, right? And that has been our biggest challenge, which is why we see the numbers constantly going up. Just in the last week, we've increased our numbers by 50 to 60,000 patients. We're at 1,000 deaths a day. We are not doing what we need to be doing as a nation to bring these numbers down. If we don't get this curbed soon and fast, and flu season is going to be not a fun place, and we don't want to be there, I can assure you guys that. And what do we need to do, right? So we have to continue the social distancing. We have to wear our masks. It's no longer about like, it makes me uncomfortable. What about my rights? We're not going to get into any political issues here. Just scientifically, what we're seeing, if we want to get through this together as a nation, then we will have to wash our hands, wear your masks. If you want additional protection, wear that face shield on top of that. We will have to not touch our faces. We will have to do the social distancing. If you're seeing large gatherings and crowds, please use discretion on whether you should be in that crowd or not, just to keep yourself and your families and your loved ones safe. So it doesn't mean that all of those are going to go away, but we will follow the COVID-19 vaccine story closely, and I will be sure to bring you guys some more updates. If you have any questions, you know where to reach me. I'm at 972-372-9775. You can always email me or message me, and we can talk about this further. But I hope you guys all have a good weekend. Stay safe, stay smart, and make good choices, and I will talk to you later. Thank you. Bye-bye.